You have a parent 70 years or older, here are my top 10 suggestions to keep them safe in our healthcare system. Number one, if they can afford to pay for the Medigap insurance instead of accepting a Medicare Advantage plan. Again, some just cannot afford to do this, but those Medicare Advantage plans limit testing, medications, doctors, and hospitals. Get them the GAP plan. Number two, the doctors should avoid polypharmacy. That means lots of medicines all over the place, especially these ridiculous prescriptions I see sometimes, like take 1.5 pills, so you got to cut it in half twice a day, or medicines you need to take 3 times a day. Very few need to do this. It creates stress, especially for the elderly, and it markedly reduces compliance. Number 3, avoid some drugs, ones that sedate you, like sleeping pills, anxiety medicines, opiates, Benadryl, especially for men because it can cause urinary retention, and alcohol. And the other is aspirin. That's right, in the ASPREE trial, ASPREE, check it out. Data showed that primary prevention, which means you never had a heart attack with aspirin, actually was harmful. So don't start it unless you have a good reason, like a past heart attack, stent, or stroke. Discuss this with your doctor. Number 3, be cautious of over-testing. You see, Medicare, not the Advantage plans, has no gatekeeper. And that lets some of the criminals in medicine, well, it lets them do lots of tests on these poor elderly patients. Echoes, stress tests, EEG, carotid studies, transcranial Dopplers, cardiac angiograms, etc. Man, I've seen some bad things in my career. If you have any question, ask. If you're not happy with the answer, get a second opinion. It saddens me, it really does, that I continue to see this happen. It's out there. Number 4, get them in an exercise program. That's right, walking, and yes, resistance exercise, weight training, not the oomph, but yes, weight training with light and comfortable weights to reduce muscle loss and fall risk. Fall risks are as deadly as a heart attack. Number 5, don't forget the basics. Make sure their blood pressure is treated well as their lipids. Number 6, controversial for you guys, but you got to discuss vaccination. Definitely the yearly flu vaccination and a pneumothorax, talk about shingles vaccine and RSV. Make an informed decision about the other vaccines. Number 7, becomes harder to travel for health care. And often the best, well, they can be far away. Now, medicine is important, and you need to find someone close by for typical daily medications, and things like that. But for complex stuff like TAV or atrial fibrillation or heart surgery, you got to travel. Travel to get the best for complex diseases. It's even more important in the elderly because they're higher risk. Number 8, get a good Medicare Part D drug insurance. Otherwise, if mom or dad gets sick, they may not be able to afford that medication. That's right, like Eliquis, for example. Number 9, find a great primary doctor or geriatrician that sees the patient and has daily availability for urgent visits. You don't want mom or dad in the emergency room. And 10, oh boy, keep them away from those sales pitches on TV guaranteeing anything from relief of pain, better sleep, better memory. They're almost all bull crap. And mom loves to buy stuff on QVC or advertise on our favorite show, and the next thing you know, she's got these huge credit card bills. Hope that helps.